Let's get right to some analysis of everything that we watched for the last few hours. Our senior medical analyst, Dr. Marc Siegel, joins us now. I want to play something that RFK said in his opening statement. Listen here.
Advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly.
It was a hearing that was contentious at times. A lot of questions that were asked that required a nuanced answer. But when he started to give one, Democratic senators would shut him off to say, I asked yes or no. What did you think of the entire hearing? What do you think of Kennedy's philosophy and how it might apply to HHS? And
I'll add that what Shannon Bream said before we came on is he didn't get to answer. They weren't interested in his answers. They were interested in their statements, not his answers. But what the sound
Never seen that before.
I've seen that all the time. You've seen it every day here. But I actually, the clip you just showed, he even went deeper and beyond that and said, I'm going to take on things that are stayed in this society that lead to the epidemic of obesity that we have. 40% of it, 45% of adults, 20% of children, chronic disease that results, allergies he talked about, which he hasn't talked about before, addiction. All of that is connected because addiction is connected to poor eating habits as well, not just drugs. So he put that all together. But what he said that was most significant is he said, I don't care who stands in my way. I don't care who tries to stop me. And you know who's going to try to stop him. Big Food, Big Pharma, all the big guns in the lobbies here in Washington. And he says he's not afraid of that. He didn't take this job. No, he knew he was going to get a battle, and I think maybe that was his strongest moment.
Yeah, and interesting that you mentioned addiction, because he talked about his own. He said he was addicted to heroin for 14 years. He's been 42 years clean. He says he goes to a 12-step program every day. So he's constantly hearing stories from other Americans about fighting their addiction. So he's seeing that problem up close and personal every day.
And he talked about the wellness farms that he's talked about, but he stood up for them and said they're not, instead of antidepressants, they're not for everyone. They're an option for someone that is in trouble, that can't do better. I think he fought back against the idea that he said previously about antidepressant use. He said, you know, he's for it, but for the right people. And that brings it back to the doctor's office, Shannon. What is my role in the doctor's office? It's to make these decisions with the patient and to have availability, not pressure from outside. Availability of medicines, and then I and the patient decide whether to prescribe them or not. There was a lot of nervousness on the part of the Democrats about vaccines. But what Kennedy is saying there is, he wants more transparency. He wants nothing to be off the table. The Democrats are saying, yeah, but you're going too far in that direction. We already have a problem with vaccine confidence in this country in terms of a drop in the early childhood vaccines that's come out of the pandemic. That worries me, by the way, regarding Kennedy. But Peter Marks, who's the head of vaccines at the FDA, has said, if he's confirmed, I'll work with him. Let's work together. Maybe he'll bring up something I didn't think of. He says, Marks, tremendous transparency here at the FDA. He doesn't agree that there are secret files, but let Kennedy bring it. Let him bring it on, and we'll work together.
So Senator Warren brought it up twice here, and she was trying to hammer him on something that happened in Samoa, 2018, 2019, where vaccine compliance dropped from in the 90s down to 31% because of an unfortunate situation where a nurse had accidentally mixed a muscle relaxant with the measles vaccine, and 2 children died as a result. Kennedy happened to visit the island the following summer, and then shortly after that, somebody from New Zealand came in with a bad case of measles, spread it throughout the population because there was low vaccine compliance, and a number of people died. She was trying to pin that on him.
And he was trying to say, I came a year later. And it already had happened before that. And I think that was clarifying. And that was one thing that was disappointing, was they didn't want him to answer the question. I mean, and they, in a way, it was really unfair because they're talking over the voice problem he has, right? So he can't talk over people in reverse. And that was totally unfair. But I guess you guys are used to that here in Washington.
Never seen it before. Like I said, first time ever.
Yeah, Dr. Siegel, thank you
Thanks,
very
Doc.
much.
Good to see you, DC.
Great to have your
Great to see you in
insights on
person.
Hang around for a bit. Open up a practice.
I'd love it.
We've got questions.
We got lots of clients.
You always ask me questions, but you're in great health, both.
We got lots of clients for you because there is an epidemic of chronic disease.
And that's really true, and that's so important that we get at that in the food.
Great to see you, Doc.
Good to see you.
Thank you, Doctor.